So break down for me also
Hmm.
what you saw after that hydroxychloroquine. So by the way, in California, by that point, we had a governor bringing in a hospital ship, telling us we have to lock down. Mayor in Los Angeles telling us no hope, mass deaths, shelter in place. Those
Right.
are words you utter when there's a nuclear attack about to hit the city. I mean, literally. And I was like, what is he saying? It's just so unhealthy. But I'll let you kind of go back to the hydroxychloroquine presser and move us forward from there.
Well, for me, the big thing isn't so much the hydroxychloroquine, which, by the way, I can't believe you've been using it for 30 years. How many people have you killed, Drew,
I know.
in
Yeah,
that
thank
span
you.
of time?
Exactly. Look, hey,
How
listen,
dare you?
the I word medicine is the same thing.
Oh,
Do you know ivermectin is actually mandated for patients, for people that come in as refugees into this country? The CDC mandates a week of ivermectin for everybody that
hold
sets
on.
foot on this soil. So
Hold on, Drew. The next thing you're going to be telling me is that the guy that found the compound won like a Nobel Prize or something.
yeah, shocking, right? Shocking. But anyway, that's sort of incidental. And by the way,
Right.
just to be clear, these things don't work for COVID. Really, I don't think at all. I mean, certainly when you compare it to like Paxlovid now, which like boom wham, you're better very quickly. It's nothing like that. But we had nothing back then. We had zero to offer patient. And by the way, we missed a lot of things that we could have done because people were trying things that were working, like steroids and budesonide. And we missed all those things because no one was willing to talk about treating their patients for fear of somehow not being a part of the cool kids club or something. I don't know what it was, but go ahead.
And well, I mean, we can get back to the cool kids thing later, but it was the strangest thing because, even, I mean, the debate about the eye drug, and to some extent, hydroxychloroquine, as I understand it, is kind of still raging. But the point for me is, well, we have these other physicians who swear by these drugs, and they claim that they're having great success with them. And my question from the jump was, well, why would these people put their reputations and their careers on the line to push these particular drugs if they're not working? It's not me saying that there's some sort of magical wonder drug. I don't think that's the case. I think a lot of doctors are advocating for, a course of drugs, given wherever you're at the disease at that and in your particular profile. And but the main thing for me was over time, and maybe this is my bleeding heart artist, part of me that's sort of speaking out, but I said, it appears to me that everything that we are being asked to do in order to mitigate the spread of this virus goes against everything that makes life worth living. And that extends to what they're doing to kids. I mean, I got pulled into this group of moms on Twitter, in a Twitter chat, because I was one of the people who was speaking up about the school closures. I'm like, dude, private schools are still open. These European schools are still open. Why are we doing this in America? And why are people pretending as if these other countries don't exist? And so it was just a very, very weird thing that we saw, I guess, being on the outside of it, watching people just sort of careen from one narrative to the next based on whatever the headlines were versus the people who were shunned as anti-science or whatever, who were saying, well, no, we have a lot of data here. We'd like to just talk about this and have a debate about this so that we know what the best course of action is. And
that's right.
The same thing with the lockdowns as well. I'm somebody who, I think I'm one of the few actors who thinks that economics is important. But whatever people might think about that, it's part of the thing is that you have to sort of you have to look at the trade-offs of whatever you're doing. And it's totally understandable at the beginning where we said, we don't know what the hell's happening. And maybe it's a good idea to kind of take a pause and step back for a little bit.
Sure.
But
absolutely.
But over time, when it just began it was dragging on and on and on. And just especially living in the city, I call it the city formerly known as New York. It's funny I'm listening to what you were talking about
very funny.
With what was going on in LA. I mean, people weren't really talking about here. First of all, our doofus former mayor, Bill de Blasio. I've never met anyone who likes Bill de Blasio, much less anyone who ever admitted to voting for Bill de Blasio. But this guy at the beginning was saying like, oh, go out to the movies. March 15th, he put out this tweet. March 15th, 2020, he was like, I just saw this great, I can't even do his doofus voice, but, I just saw this great movie. Go check out, this film and go ride the subway, yada, yada, yada. And then, of course, they changed their tune very rapidly. But, the same kind of deal with New York. We had this hospital ship that came in, was barely used. We converted multiple facilities in Manhattan, in Queens, and in Brooklyn in order to handle overflow. They were barely used before they came down. And there just came a point where it seemed as though the restrictions were either maintaining or increasing, despite all these other, these other tidbits and infos and signs of improvement that we were going through. On top of that, there was a small Jewish outlet, and I can't remember the name right off the top of my head, unfortunately, but they leaked a phone call with Andrew Cuomo speaking with a few rabbinical leaders or whatever. And Andrew Cuomo said point blank that these are fear-driven policies. These are not nuanced. They're driven by fear. And then when you think about, there was a New York Times article that came out that around April 2020, where 3,700 people were added to the death toll, but they weren't. But it was presumed COVID deaths. They were never tested. I'm thinking to myself, okay, wait a minute. At a time where we need as accurate information as possible so that we can really assess how deadly this thing really is, why are we guessing? Why are we doing that? But the point is that, and then when you think about the nursing home fiasco and how tens of thousands of people, I think, needlessly died, allegedly, because of these actions. So these numbers are these numbers are being used to pump these fear-driven policies that are allowing Andrew Cuomo to sell a book and to win an Emmy and to be called America's governor. Meanwhile, I'm like, dude, no, you're totally botching this and you're destroying the city. And
but he was not alone. He was not alone. It really was coming from all sources, and I've come to understand through interrogating various people that were there in real time, much like yourself, and were sort of paying attention, that the fear-based policy was exactly what they were using, without regard for the full impact that would have on the populace. There was no risk-reward analysis done. I agree with you on that. But this fear thing, I really want to understand what they were doing, because it seemed so nonsensical at the time. But the fear-based policy was to get to a vaccine. We're gonna really, this one death is too many policy, which is, you can't practice medicine. It's just. And by the way, think of the many, many, many tens of thousands of deaths they caused with what they did. I mean,
right.
This is the point. Yeah. Of course, one death is too many, but doing too much to save that one is going to cause thousands of others. You have to be nuanced in what you're doing. But the fear-based policy was to get to a vaccine. So it was vaccine uber alles, and in the meantime, safety uber alles. Both not very nuanced policies. And as you look back, probably not right policies. The CDC states that COVID-19 vaccines are safe, effective, and reduce the risks of COVID-19. Always consult with your personal physician before making any decision about your health.